Hi, I'm Donna and I'm from the Wellbeing team at Bendigo Senior Secondary College, and today I'm here with Dr Chris, who's a GP in Bendigo. Dr Chris, what role can a GP play in the wellbeing of young people?
We've got many roles that we can play. Wellbeing means many things, but I see it as a GP in a holistic way, so it includes our mental health, our physical health and our social health. And what I mean by that is that we GPs can actually help with all of those aspects of your health.
So what are some of the reasons why a young person might come to see you?
There are many reasons, Donna, including everything to do with our physical health. So that might be something sudden or new, or something that you're living with like asthma or diabetes. It might include something to do with your mental health, like feeling a bit down or feeling a bit anxious or worried or having trouble with your sleep. We do a lot of work around sexual and reproductive health, so we might help young people with their contraception concerns or STI checks or worries about unplanned pregnancy. We also help with referrals and guidance around finding appropriate professionals to help the young person with their needs.
What can someone expect to happen when they come to see you?
So a GP works in their own private room, which has lots of medical equipment in it, usually a couple of chairs, an examination couch, some hand washing facilities. A GP will introduce themselves, will ask you to have a seat, and then generally ask a fairly open question of something like, how can I help you today? What we would suggest for young people is that because it can be a little scary the first time you go on your own, is maybe having something written down about why you want to come, and make sure that you cover those things in that time when the GP asks you. Sometimes a GP will say, look, we've got time to deal with a few of these concerns today, and maybe we'll need another appointment to follow up some of the others.
What would you say to a young person if they were feeling anxious or apprehensive about seeing a GP?
So there's a few reasons I could imagine that a young person might feel like that. One of the really common ones is around privacy and confidentiality of their health information. So having a conversation about that at the start of a consultation can be really important and helpful for the young person. The other thing that might help is writing down some things, as I mentioned before, but also bringing a support person. So you can bring a friend, a trusted adult, a family member along to an appointment and have them there beside you, and then they might be asked to leave at some point in that consultation to give you some time on your own when you're feeling comfortable.
So if someone has made the decision that they would like to see a GP, how do they go about it and what are the options?
So you can book an appointment online at most services these days, or you can phone for an appointment. You can also ask a trusted adult or somebody who's supporting you to make that appointment if you feel comfortable to do that yourself. The other thing that young people sometimes worry about is their Medicare card and whether they have to have one. And young people can have their own Medicare card, but also medical receptionists can help by finding out the Medicare number and helping with some of that administrative challenge that some young people get a bit worried about. The other thing that would be helpful is to arrive a few minutes early for the appointment. There's often administrative things that have to be done if you're a new person to that service. And also, with COVID, there's often some checks or some things that have to be done around that as well. Also, arriving early means that you get to check out the space a little bit. You usually are asked to wait in a waiting area. In that time, just be aware that GPs do get behind and you may have to wait some time to see them. At the end of the appointment, it's important that you know how the billing process works, and if your service is being billed to Medicare, that's just a matter of the receptionist putting that through to Medicare. But if there is an out-of-pocket cost, you will need to have that explained to you as well.